Greetings, everyone. Thank you for tuning in today on Dr. Gerald's Healthline as we're going to be discussing issues that pertain to your health. Once again, we are in the series of fracture discussions concerning upper limbs and lower limb fractures. I want us to look at the issue of fractures of the humerus. I'll start by telling you a story of a young lady who was brought to the clinic just about 3 days ago. She was in a vehicle and there was a collision with another oncoming vehicle, and then she sustained multiple injuries, but most importantly was that there was a deformity in the arm. The arm is that part of the body between the shoulder and the elbow, and then there was associated pain, and this resulted in her being taken to the hospital, and finally she was brought to our notice. We requested for an x-ray, and the x-ray showed that she had a comminuted fracture of the humerus. Now, what does it mean to be comminuted? It means there were multiple segments of the fracture. It was in multiple pieces. And in this type of case, you have to take an appropriate decision on how to manage these patients. Why did I decide to talk about this today? Because there are many cases of this kind that usually will end up taking home care or going to some kind of maneuvers at home that result in application of very tight splints to that area and consequent occlusion of the blood supply to the whole of the upper limb, resulting in what we call compartment syndrome. Sometimes they come down with Volkmann ischemic contractures, and that limb is completely deformed, and some of them has gone ahead to have complications resulting in amputation of that limb. Now, this does not need to happen. So if you have anyone who has got a fracture, a deformity, pain, or abnormality following trauma, most of the time probably home accidents, like in children, the case of a fall with an outstretched hand, or a child, or probably in road traffic accidents. If you have those kind of cases, please hear me today. See your doctor. Now I'm talking about seeing an orthopedic surgeon who will be able to assess the case and know if this is the best case to be handled with or without surgery. Okay? It's not every case that requires surgery. There are some of them we can put what we call the hanging splint. There are some of them we can, do some kind of manipulation under image guidance, and this will result in resolution of that case. There are those ones we see and we say we need to operate. That is, we're going to open up and fix so that the individual can return back to their normal life and function. Now, imagine where this is happening on the right upper limb. It can be a very big challenge because that may be the handedness of that particular individual. For those who are right-handed, use the hand to sign signatures, to write, and to perform the duty that usually gives you your wages for the period to survive. And so this makes it very pertinent that you take that decision. So if you have such a case and you don't know what to do, don't fail to write us. You can send us your x-rays on our webpage, okay, Dr. Gerald's Healthline, and we'll be able to help you take that decision so that you are guided to stay healthy and take the appropriate measures that will help you return back to your pre-morbid state. That is the state that you were before the accident. The accident does not have to be a bad news. It can be turned to a testimony, as it were, if you are doing the right thing. So tonight, looking at the humerus fracture, there are different parts of the humerus. It can be at the proximal part, it can be at the middle, or at the distal part. Now, each and every one of them have got different kinds of approach for their treatment. So if you have anyone that has got this condition, please, this is not the type you say you want to manage at home, or you want to try applying splints at home. Yes, you can do some things like immobilize the limb. You can tie something on the arm and put it around the neck and then move the person to the hospital immediately. Now, there are some times that these patients go to some places where they go to for immediate care following the incident, okay, maybe on the highway, and you see people apply splints to the hand with the elbow in extension. That's terrible. That's terrible. When you have the elbow in extension, that's not the functional position at all. Okay, you need to put the elbow in a flexed position and then apply a collar and cuff splint. You can use anything, even a shirt can do that. Okay, anything can be applied just to hold the arm in a flexed position with the elbow flexed. In that position, you can move the patient comfortably to a hospital where there's an orthopedic surgeon, and then the x-rays are done, and these patients will get the required help. I want to say thank you for tuning in today. We're going to continue on this series. Then within the next few weeks or few days, you'll be hearing from us again. I want you to watch out on this dial as we'll be reaching you to talk more on fractures concerning your upper limb. Thank you for listening in. Stay healthy and see you soon.